If you look at digital and IT and the landscape in healthcare, in hospitals, what would you consider as the top 3 challenges?
Of course, what we have seen, people evolving to more distant consultations and remote working, this tendency was already present, but what we see now more happening is that systems you get intrusion into systems, systems get hacked, and that's of course cybersecurity. That is a main challenge, and it is a real nightmare when those cyber attacks come into a hospital, because you immediately have to close down when you're in the midst of a pandemic, and you have to close down your hospital or reduce your activity or fall back onto paper-based processes. This is very, very difficult. So that's a very, very big challenge. Of course, due to the fact that you're evolving into a patient-centered approach, the patient pathway is central, and it does not stop at the door of the hospital, and it begins at the door. It begins earlier, and when the patient is discharged from the hospital, it continues at the home of the patient, or in some rehabilitation setting or whatever. And what we see is that the care gets more and more integrated. So you have issues of interoperability of systems and getting access to systems. So the access to the healthcare is very important, but it's also the access to the data, not only for the patient but also for the caregivers. So this is a second aspect that we see, and so how to realize this is an important issue. And the third one, of course, into the pandemic, we have a lot of people working in the hospitals that work from home. And it is not only the administrative staff. Of course, they must be able to work from home, and sometimes they work on systems that are not so, that is not easy to start up from home, because there's all the legacy systems that are in place. But it's sometimes also you are specialists that for some reason they are in quarantine or in isolation, but their expertise is needed. So they need to have access to all the systems, and not only the systems that they're used to work, but also due to the specialty, maybe to a device that is into a treatment room or whatever. So this is very important, and that is another issue. So we see 3 issues, I would say: cybersecurity issues. Secondly, the fact that people have to collaborate, not as an integrated care. Also, hospitals are forming networks, so different systems that have to collaborate. And thirdly, working from home, because you're needed due to the context we are living in.
Yeah, absolutely.